health conditions transitioning from the pediatric to the adult healthcare system. And this is in fact what my research focuses on. I was inspired to conduct this research based on some gaps that I observed in clinical care and the stories of youth that I worked with. That really inspired me to pursue my doctoral training and address this topic in further detail. And I'm a real passionate advocate for partnering with youth with lived experience in health and mental health research. And you'll get to hear a little bit more about that today. So thank you so much for the opportunity. And I'm joined by Megan Patton, who will introduce herself now.
Hi, everyone. My name is Megan. I'm a graduate student at the University of Calgary, specializing in health services research, and I am a young adult research partner on Brooke's thesis project.
Wonderful. So you'll get two different perspectives on patient partnership and research today, and we're really excited to engage in a fun conversation. So I'll be sharing some key insights in the first portion of our webinar today from a journal article that I co-authored with Dr. Gina Dimitropoulos, who's my thesis primary supervisor, and Dr. Kathleen Sitter, who's on my committee. Both are assistant professors in the Faculty of Social Work. So we'll begin by providing a bit of an overview of the pragmatic research paradigm, and then describe some congruencies between pragmatism and patient-oriented research. Now, I know some of these concepts can feel really theoretical. So in order to really ground things in a particular project, we're then going to review a case exemplar. And Megan in particular is going to speak to how we applied a pragmatic lens to patient engagement in my thesis project titled The Ready to Exit Study. So I thought I would start by talking a little bit about research paradigms just to kind of situate us. A research paradigm is a set of guiding values about scientific inquiry that consists of one's ontological commitments, epistemological beliefs, so how we know what we know, and methodological preferences. So for us as researchers, the adoption of a paradigm supports us in better understanding our beliefs about the nature of knowledge, and then selecting the methods that are best suited to address our research questions. I almost like to think of paradigms as a bit of a funnel where all of our assumptions, beliefs, and values are filtered in, allowing us to clearly define our stance and defend and make decisions about our guiding theories, data collection, and data analysis strategies. So I thought I would open it up for just a little bit of discussion. I wonder if anyone in the virtual room here is open to sharing what kinds of research paradigms you might be familiar with or maybe have used before. And you can either use the chat or you're welcome to share verbally.
I can start off. In my undergrad, we never really talked about like specific research paradigms. We talked a lot about paradigms kind of as a whole. But as I started getting into my own research, I've done a lot more about post-modernism and feminist paradigms. Yeah, Brooke, what about you?
Amazing. I see in the chat we have positivism and post-positivism. Thank you so much for sharing. And thanks, Megan, for giving us some of your insights. Kind of similar to you, my master's was clinically focused. I didn't do a ton of research until my PhD. And it really wasn't until some of the theory courses that I began kind of understanding more about different paradigms. And immediately I was drawn to pragmatism, and you'll hear a little bit more about why throughout the presentation. But I'd also heard a lot about transformative and participatory paradigms. However, I feel like often these concepts aren't really delved into very often. So I'm excited to share a little bit more today about how I've been thinking about some of these ideas. All right, so this is a snapshot that comes right out of the article that we're presenting on today. And I know it's a lot of text, but really what I want to highlight is that there are key features of 4 commonly used research paradigms that are presented here. And this is by no means an exhaustive list, but some of the commonly used paradigms. And what you'll notice on the bottom column here is that while individuals with lived experience or patients are central to all types of research, their involvement in projects really varies depending upon the paradigm and the methods that are used in a research study. So much has been written about the roles of individuals with lived experience in the transformative or participatory paradigms. However, less is known about synergies between the pragmatic paradigm and participatory methods like patient-oriented research. So in this presentation, Megan and I will be illustrating how pragmatism can be adopted to underpin patient-oriented research studies using my thesis project as a case example. So let's dive in and talk a little bit about the pragmatic paradigm. So the pragmatic paradigm focuses on solving problems through inquiry. Its goal is to use the best methods possible to address pressing real-world problems, and it relies on the experimental method for doing so, where solutions are tested and either accepted or rejected, depending on the utility of their findings in a particular context. As such, reality is negotiated and interpreted based on the usefulness of a project's findings in a context. And within this paradigm, human experience is the primary means for building knowledge and understanding the world. As such, knowledge is constructed by interactions between people and their environments. Now, I want to emphasize that within pragmatism, context is really important. So we know that solutions to pressing problems may not work across different times and places. Thus, we need to use the experimental method within specific local contexts in order to generate knowledge that attends to the needs of a particular group at a particular place in time. So the pragmatic paradigm is commonly used in mixed methods research. And this is because it does not privilege one research method or type of data over another. It's accepting of different perspectives, interests, and forms of knowledge. And it allows for the use and mixing of different data sources because of this within the same study. So often what we see in pragmatism is that we use and rely on whichever methods will best address the issue that's under investigation. And this could involve using different data sources. What I think is really neat about pragmatism is that there can be different perspectives and forms of knowledge that are used within a study. So this can include experiential knowledge or lived experience. And this already begins to suggest a potential alignment between pragmatism and patient-oriented research. We also know within pragmatism that the social problems, which we want to investigate through inquiry, are best defined by those experiencing them. And in fact, we often find within patient-oriented research studies, if we can get into priority setting with folks who are actually experiencing the issues at hand, we'll end up with more actionable research questions. Wonderful. Here's one more. I promise it's the final one. One more little question for discussion. I wonder if anyone is interested in sharing a little bit about what interests you about patient engagement or partnership in research. And again, you're welcome to use the chat or unmute yourself and share. Yeah, thanks, Jamie. Lived experience, absolutely. Beautiful. Thanks, Isabel. You're a patient partner. This is how you're contributing your expertise, keeping research relevant, hearing more about the experiences of maybe vulnerable populations and valuing different types of perspectives. Beautiful. It's a collaborative approach. Yeah, I love this. I love this. And now the reason that I asked this question is because I feel that it's really critical, whether you're a researcher or a patient partner, whether you kind of cross into both camps, it's essential to reflect on our values, assumptions, and motivations for engaging folks with lived experience in research or for being patient partners ourselves in patient-oriented research, as I feel this can help us to select appropriate paradigms, methods, and even knowledge translation plans. So I feel that this coherence is really important. And I always love hearing a little bit more about some of the motivations or the interests that people have for conducting this type of research. So thanks, everyone. And I'm seeing some reflections continuing to come in, which is wonderful. All right. So we've talked a little bit about pragmatism. Let's shift gears and talk a little bit more about patient-oriented research more broadly, and then we'll talk specifically about how these two concepts intersect. So this should be a review for probably most people here. Patient-oriented research is a form of research that engages patients as partners and really aims to transform researcher-patient relationships from paternalistic, which we see sort of historically, to much more patient-centered. It really focuses on giving voice and ownership to folks with lived expertise throughout the research process, if it's done well. And what we know is that patient engagement or involvement can occur at various stages of the research process through things like thoughtful dialogue and consultation, but I'd actually suggest we can move even further into active partnership and having patients be the ones who are making decisions and kind of governing research. And this engagement can occur at various stages within a project or study, from the priority setting phase, throughout design and governance, all the way through to the knowledge translation and dissemination phases. Now, similar to pragmatism, I feel that context is a really central feature of patient-oriented research. We need to ensure that the knowledge that we're generating through patient-oriented research really applies to a particular context, time, and place. And we need to think about what kind of knowledge would best serve the interests of a particular group or community. We see from the literature that this type of research can in fact lead to things like increased retention in large randomized control trials, more relevant and culturally appropriate methods, and more relevant research questions. And often what we see is that the findings of patient-oriented research projects have really applied clinical practice and policy implications. And I'll give you an example. We've seen that in pragmatic clinical trials that take place, when patient partners provide their perspectives on enhancing the practicality of these large-scale clinical trials, they're able to make sure that the methods that are being used are actually responsive to the needs of folks enrolled in these studies. So the involvement of patient partners in clinical trials, for instance, might suggest that we use more patient-reported outcomes like quality of life, because that matters to folks with lived experience, as opposed to clinician-administered tools. And this is a great example, I think, of how the involvement of patient partners can enhance the practicality and the real-world application of these concepts in practice. Wonderful. So here's a continuum. This is by Vandal Walker, and you may have seen similar sort of continuums within either participatory methods or patient and researcher engagement in research. What I want to highlight here is that patient roles in the research process vary depending on your research question, the resources available for a project, the goals of the study, and of course, the preferences and goals of the patients involved. So this can sort of range from learning and informing, which is all the way over on the left side, and learning and informing and participating in research are roles that patients often adopt in more traditional forms of research. And then as we move along the continuum into the gray shaded area, all the way over to the right side, we're seeing patients playing more active roles in the research process. Having them kind of move all the way into leadership roles where they're actually making decisions about projects. And so I think it's just important to reflect on sort of where you're at in sort of the research process, and just wanted to provide some context here. Awesome. So now let's talk a little bit about the congruence between pragmatism as a paradigm and this method of research, patient-oriented research. So first of all, we know, and we've talked about the fact that pragmatism provides an action-oriented framework for research. We know that addressing practical issues arising directly from communities is critical, using the most appropriate methods possible for doing so. Both of these approaches sort of allow for a multifaceted approach to research, where different skills, perspectives, and forms of knowledge are valued, including the voices and the expertise of folks with lived experience. And I've given you some examples already of how partnering with patients in research can in fact enhance the practicality of research. It ensures the priorities, research questions, and our collection methods are responsive to the needs of communities. Now, in the paper, I highlight three sort of concepts in which we see clear coherence between pragmatism and patient-oriented research. And so I'll walk you through each of those three concepts now, and you can read more about them and some examples within the paper. So the first is democratic values. Underlying the pragmatic research paradigm is John Dewey, one of the founders of pragmatism as a philosophy. It's his guiding principle of democracy, where the goal is to minimize imbalances of power by engaging communities with different perspectives to obtain their input on priorities for inquiry. So that's a clear alignment between sort of that approach to research and pragmatism as a paradigm. The second is collaborative problem solving. The process of working collaboratively with community members characterizes both the pragmatic method of inquiry and the democratic model, which we just talked about. Here we have a shared responsibility for problem solving, flexible negotiation, and open dialogue to come to mutually desirable research questions. And these are both guiding principles within pragmatism and patient-oriented research. And finally, we have pursuit of social justice. An important principle in pragmatic research is the commitment to producing a positive change in the world by addressing a problem through experimentation in context. The pragmatic paradigm operates in pursuit of social justice, using inquiry that's both action-oriented and context-specific. So pragmatism and patient-oriented research are connected, and that they both aim to generate knowledge through inquiry that warrants action and stimulates change. So by sort of discussing the alignment between these approaches across three concepts, I propose that pragmatism is a fitting paradigm to use to conduct patient-oriented research. All right, so how does all of this apply in practice? Now we're going to have some fun and really talk about how we sort of lived out and carried out some of these values and principles in a particular study called the Ready to Exit study. So this is an acronym that stands for the readiness and experiences of adolescents and young adults with co-occurring health and mental health conditions exiting pediatric services. And as I mentioned earlier, this is my thesis project. So by way of background, we know that the transition from the pediatric to the adult healthcare system is often a high-risk period for youth with chronic health conditions like diabetes or congenital heart disease. Youth often report feeling unprepared for this transition from one system to the next. And in fact, this period has been associated with poor health and psychosocial outcomes for youth. There are several barriers associated with this transition, including a fear of leaving familiar pediatric providers, changes to caregiver involvement in care, and a lack of specialized providers. Interestingly, up to 59% of youth with chronic health conditions also experience mental health issues. This is much higher than we see in the general population, where rates are closer to 10 and 11% for both depression and anxiety. We know that mental health conditions in youth with chronic health conditions are associated with a host of challenges, including decreased medication adherence, increased healthcare utilization, and poor quality of life. We even see longer hospitalizations, higher morbidity, and 51% higher healthcare costs when we see the co-occurrence of health and mental health conditions in youth. We also see that the presence of mental health comorbidities in youth with chronic health conditions may uniquely impact those in the developmental period of emerging adulthood, where young people are aiming to forge their own path. This period often corresponds with the desire for autonomy, simultaneous life transitions, and evolving family member roles. However, mental health conditions may affect young people's ability to kind of take some responsibility for their healthcare self-management during a time in which expectations for self-management are customary. Now, a known facilitator of transition success in youth with chronic health conditions is the development of transition readiness, or health-related knowledge and self-management skills. While considerable research has focused on the topic of transition readiness and how we can promote that in youth, little is known about how self-management skills are developed and solidified if a young person has a mental health comorbidity. As such, I feel that research is needed to explore the transition readiness and experiences of transition age youth who have co-occurring health and mental health issues using a patient-oriented research approach. So our objective in the Ready to Exit research study was to understand the transition readiness of this group, and this work was guided by two overarching questions. The first was whether a mental health comorbidity was associated with transition readiness in youth with chronic conditions. And the second related to the experiences of this group as they prepared to exit the pediatric system. Here, I'll just briefly outline Ready to Exit's study design. So this study uses what's called a sequential explanatory mixed methods design, and it's also been conducted in collaboration with youth. So in phase 1, we addressed that first research question using quantitative surveys. In phase 2, we conducted qualitative interviews with young people to better understand their experiences facing transitions. Phase 3 involved the interpretation and the integration of our findings from the first 2 phases. And finally, we're now in the knowledge translation phase where we're aiming to share our findings widely with a large group of stakeholders. And what I want to highlight here is that the young adult research partners in this project, which you'll hear all about from Megan shortly, have been involved across all 4 study phases to bring the critical perspectives of young people to each aspect of the study. So before I hand it over to Megan to walk us through what it was like to be part of the YARP, or the Young Adult Research Partners, I'll give a little bit of background as to this group. So the purpose of the YARP was to bring the crucial voices, perspectives, and opinions of folks who had already experienced pediatric to adult transitions to the Ready to Exit study. Our aims in partnering together were to enhance the relevance, reach, and youth friendliness of the study's findings, to honor experiential knowledge, which I know some of you mentioned in the chat, in the study design, the data collection, the interpretation, and dissemination phases. And lastly, and really importantly to me, was to support capacity building, growth, and peer-to-peer connections amongst the young people involved, and to support mutual learning so that I would continue to grow as a researcher as well. So this group consisted of 5 young adults between ages 18 to 30 who had lived experience within the health and/or mental health systems and who had experienced a transition from a pediatric to an adult provider. And they were located across Canada. And they committed to being involved in this project from March of 2021 to September of 2022. Excellent. So the young adult research partners were onboarded via one-on-one meetings. I held either phone or Zoom meetings with each young person, sort of the first 5 people to reach out after we put this call out to existing patient advisory councils and youth serving organizations. And on those calls, we reviewed each young person's motivations, interests, hopes, and preferences for engagement. We then co-designed a terms of reference document to ensure that we were all on the same page about our guiding values and principles and that we were committed to the same goals. And collectively, we developed a group structure and meeting format that suited the needs of all 5 young adult partners and myself as the researcher. Now, this included working together on meeting agendas, meeting on a monthly basis for an hour and a half by Zoom at a meeting time that worked for everyone. Offered opportunities for rotating meeting chairs to make sure that each young person, if they wanted, had the ability to sort of build on their meeting and facilitation skills. And we began each meeting and ended each meeting with fun icebreaker questions to help build trust and rapport amongst the group.
So throughout our entire partnership, but specifically at the beginning, we had a lot of open and transparent conversations. And some of those conversations included things like timelines and compensation, what preferences we had for compensation. We also talked about what our time commitment would look like and how we could be flexible with those hours. We've talked about expected outputs, and then we've had a lot of conversations around authorship. In those first few months that we started working together, we also filled out a tool called the Involvement Matrix. This is a tool that comes out of a group from the Netherlands focused on patient and public involvement. And we really used this tool to identify what tasks we wanted to be involved with throughout the project and how involved we wanted to be with each task. And so at our 1-year mark of working together, we reviewed this to see if there were any tasks that we wanted to work more on, or if we wanted to add anything to our matrix. We had a big discussion about that. In the first little while of working together, we also had a conversation about skills and strengths. So we talked about what skills we were bringing to the group and what we wanted to develop. And this led to us co-developing a tool for this. And this tool really facilitated a lot of opportunities for peer mentorship among all of us, which has been really cool. So this is the involvement matrix. You can see along the top are the different roles that you can have. So there's listener, co-thinker, advisor, partner, and decision maker. And then down the side is where you'll put in different tasks for the research project. So this is the one that I filled out at the beginning of Ready to Exit. And Brooke gave us a list of potential tasks that we could be involved with because a lot of us were really new to this kind of research. So we didn't really know where to start. So it was helpful to have a little bit of guidance with that. So for example, you can see for interview recruitment, I selected wanting to be a co-thinker and advisor. And then for co-presentations, I selected wanting to be a partner and decision maker because I wanted to be really involved with presentations because that was one of the skills I identified wanting to work on. So I've been pretty involved with that, like developing presentation materials and doing co-presentations, which has been cool. And this is an example of the skills and strengths document that we have. So on the left is where we filled in what skills and strengths we had, and then on the right was what we wanted to develop. So this is like a living document. It stays in our Google Drive, and we have added to it, we've reviewed it, but you can see that the skills are much wider than just research skills. We put kind of everything that we thought we would be able to contribute. And this was a really cool way for us to be able to facilitate peer mentorship opportunities on our own because this was accessible to us without Brooke. We were able to kind of go on the Google Drive and look and see, oh, this person has this skill that I would really like to develop, and we were able to connect with them. We're also working on a commentary article right now that's kind of describing our processes of engagement, and that includes this matrix. So you can stay tuned for that. So throughout the project, we've had a lot of choice around the different methods and levels of engagement that we've done. One example of that was we actually started out as an advisory council, and a few months in, we saw that we were really contributing more than what an advisory role would entail. So we had some discussions about how we could rename ourselves to better describe the role that we were doing, and we came up with the Young Adult Research Partners. We also have a lot of clear documentation of our engagement processes. So this includes things like meeting minutes, agendas, and roles. So Brooke will always send out meeting agendas and roles prior to our meetings, which I've always thought was really helpful as a way to prepare for the meetings. And then we also, like I mentioned, have a shared drive with collaborative files. And this has really helped us to be independent and have autonomy over how we actually engage in this project, because we're able to take part in different aspects of the study whenever it works for us. So we're able to collaborate with each other outside of those meetings, basically whenever it works with our schedules, which has been really nice.
Wonderful. Thanks, Megan. So here I just wanted to highlight the menu of options that were available for the young adults to partner and engage and contribute to Ready to Exit. So you'll see there are a whole bunch of possible ways that the YARP members could contribute to the project based on their preferences, their learning styles, and their availability from month to month. So we had some young people in the YARP who were more interested in kind of reviewing documents outside of meeting times and providing written feedback. They preferred to communicate using writing. And then other people who were really excited in getting involved in brainstorming during our monthly meetings and sharing verbally. So it really depended on people's sort of learning styles and preferences. So by providing a whole range of different options, we're ensuring that this is a really pragmatic approach. And I think that aligns with some of the concepts we talked about earlier. This is where we're sort of valuing that different methods and sources of data can be linked and intertwined in order to help paint a more holistic picture of transition readiness, which is our concept of interest in this study. And I'm going to turn it over to Megan, who's going to give an example or two of how she engaged in some of these different options based on her preferences.
Yeah, so just to build on what Brooke was saying, you can see we have small working groups and independent projects here. And so this was a really great way for us to be able to still engage in the project in different ways. So for example, we co-designed the qualitative interview guide. And for that, we formed a small working group and we were able to meet with each other outside of our larger meetings and just really collaborate with each other. And that was a time when a lot of us were really interested and very available to do that. But then we also have other times where we take things and are more independent with them. So for example, with social media, a lot of the times we'll take a social media idea and we'll kind of work independently and then bring it back to the larger meetings. And I think this choice has been really helpful for us because a lot of us have lots of other commitments going on. So whether it's school or work or other patient engagement opportunities. So it's been nice when like school gets really busy, we're able to do independent work. And then other times when we're really interested in projects or we're more available, we can form those working groups and continue to contribute a little bit more. So here we have a table that's describing our roles and partnership throughout the different phases of this study. So when we were trying to make decisions on how we wanted to show and display our partnership, we thought it would be really important to operationalize and be very clear about the roles that we had. And so initially, all of this text was kind of spread out in a manuscript that Brooke was writing. And we thought it would be cool to make it into a table as a way that we could more easily understand it. And you could really just look at it and know exactly what we did without having to do a lot of reading. We had a lot of ownership over this too. Brooke made the initial draft of this and then sent it to us. And we were able to say like, no, I think actually we were a co-thinker in this role. And I think we were a decision maker in this role. So we were able to really take ownership and control of what we actually contributed, which was really nice. So this is an example of one of the TikToks that we have. In this video, I'm just talking about the process of co-designing the interview guide.
Hi, my name is Megan. I'm one of the young adult research partners on the Ready to Exit study. Today I'm going to be talking about interview guides. An interview guide is a list of topics or questions that Brooke will cover during your interview. They'll help guide your conversation. The Ready to Exit interview guide was co-designed with us, the 5 young adults on the project. That means people close to your age with similar lived experiences helped pick out the questions you'll be asked. We used our own experiences as research participants to help restructure and reword the questions to make them more youth-friendly and easy to understand. We made sure any questions that you'll be asked, we would be able to answer if we were being interviewed. If you have any questions or would like more information about getting involved with the study, please feel free to reach out to Brooke.
So these are just some more examples of the modifications that we made to the interview guide. So on the left, you can see the first question there is, can you tell me about a time when your health condition impacted your mental health? And we changed that to, can you tell me one specific story or instance when you felt like your health condition impacted your mental health or vice versa? We thought that if we were asked that original question, it'd be a little overwhelming and maybe cause us to ramble a lot just because there might be so many different stories that we could tell. And so by kind of pinpointing it to one specific story, we thought we would be able to articulate an instance better. And then the second question is, what role do your parents, caregivers, or family members play in preparing for transition? And we just changed this to, what role does your support system play in preparing for transition? Because it was a little bit more inclusive of all the different kinds of support systems.
Beautiful. And I just want to add one thing to that, Megan, if that's okay. I just
Yeah.
want to emphasize and highlight that I think these adjustments to language and the addition of questions that the YARP members came up with when they worked on the interview guide, I feel allowed us to glean more rich information than would have been possible if the guide had been developed by myself or the other members of the research team alone. And I think this is a really key example of how the YARP's involvement enhance the youth friendliness of the data collection strategies. And we've certainly reaped the benefits. The interviews were incredibly rich, and I do feel that the adjustment in some of this wording helped to elicit more full responses.
So now we're just going to share some of the contributions and outputs that we've had so far. So myself and some of the other YARP members created the study logo. We co-designed the interview guide. We have created a youth-friendly social media strategy. And then we've also started to make TikTok videos. So if we want to just like quickly tie that back to pragmatism, this is really about making everything very youth-friendly and increasing the reach of the study, because we're sharing these findings and this information outside of traditional academic channels. We want to go where youth are and share information that's relevant to them, where they'll be able to find it. And so far, our content has been educational about the study or about patient engagement and recruitment info. But now, as Brooke is starting to wrap up her thesis, we've started to brainstorm ways that we can share the study findings that will be relevant and impactful to youth.
Beautiful. Thanks so much, Megan. We just had our last meeting actually of the YARP on Monday of this week. And that was a really sort of exciting meeting. And we talked a little bit about how maybe TikTok and Instagram would be great channels to use for reaching youth and young adults. And then the YARP members thought that perhaps using Twitter and newsletters and infographics might allow us to target and reach clinicians, policymakers, and other folks in sort of the academic sphere. So I think just considering different channels for different audiences has been really amazing. So in terms of some other outputs that we've seen based on the YARP's involvement, I think certainly there's been a really nuanced perspective regarding the variables that we looked at, especially in the quantitative analysis and the data interpretation phases. So the YARP members have all brought their unique lived experiences to this project and have really expanded our perspectives, I think, on how to integrate these concepts and come up with some recommendations for clinical care. Megan talked a little bit about that peer mentorship and ability to connect with other people. And it seems to me the relational component of this project has been really impactful for me and for the YARP members. So they've all been able to create connections and friendships that I hope will extend beyond this project and to learn from each other based on the skills that they bring into this group. And it's been really amazing to witness that growth. We've also seen great capacity building. So the YARP members have expressed to me that many of them are developing, skills in research that they didn't have before. But I would also say for me, I've grown and expanded and, learned so much about social media, for instance, and graphic design when it comes to logos and how to target different audiences. So I think that's just a great example of the mutual learning and capacity building that can happen for both, patient partners and researchers when it's done in this way. And lastly, we have co-authored manuscripts that are under review and one that's already published. We're working together on that manuscript focused on our processes of partnership and always looking for ways to co-present and partner in sharing these findings widely.
Yeah, so like Brooke mentioned, we've done a lot of knowledge translation. So we've done 6 presentations to date, and some of those include SPORE Northwest Virtual Institute last year. We did Academics Without Borders, and we did a University of Calgary doctoral level research course. We've also co-authored one manuscript that's been published. We have one under review and one in preparation. And then we've also developed a TikTok and Instagram account in December. So you can see some of our stats right there. We thought it was really important to have a social media presence as a way to humanize the process a little bit and make it a little less scary for people that might be participating in the studies. And it's also been a really cool way to create community with other research accounts. We've been able to connect with lots of other research and youth engagement accounts, which has been awesome.
So just as we're getting near the end here, we'll share a couple other examples of TikToks that we've been kind of creating and using on our account. We're trying to share knowledge about our processes of partnership and also just trying to create a fun and engaging presence, like Megan said, to encourage potential participants to get involved. That last one, I'll just highlight it. The sound was a little off, but it's a trend. And that's another thing that Megan and the YARP have taught me is around trying to capitalize on trends, think about trending sounds, hashtags in order to engage with different audiences. So sometimes it's about stepping outside of your comfort zone to try to create those connections with an online presence. So as we wrap up here, both Megan and I are just going to share some lessons learned about sort of engaging and partnering in this process and some connections to pragmatism. So I feel it's critical. And one thing that I've learned is the importance of meeting young people where they're at by providing tailored opportunities for engagement based on their existing skills and those that they hope to develop through the partnership. I've learned the value of providing different options for compensation and ways for the YARP to contribute to the project based on their interests. And I've also seen the value in really trying to strike that balance between a structured approach, which I think aligns with pragmatism, where meetings and materials are well organized and there's a lot of predictability and we're really trying to achieve a certain outcome or goal, while also leaving some room for flexibility and creativity and fun. I think that's where that beautiful space that you can find in between allows you to come up with some outputs that might not have been possible if you were sort of more structured and rigid. I've also seen that YARP members really liked guidance, as Megan said, on some aspects of the research project. So I provided a draft interview guide because a lot of them didn't have experience with creating questions, but then giving them more independence and autonomy over other aspects like social media, just based on their interests. And I think lastly, we've learned the value of adapting our partnership processes to the local context, which aligns really closely with pragmatism. We've really considered this group's needs and the milestones and deadlines that I'm expected to achieve as a doctoral candidate. And so we've considered factors like time, resources, interests, and expectations of the group. And all of these can be really important when you're trying to apply these concepts to practice.
So I just wanted to share a few of my lessons learned. So I've really seen how beneficial it is to have a trusting relationship, not just with Brooke, but also with all of the other YARP members. I think this was a huge factor in what kept me so motivated and engaged throughout the last year and a half. It was just always fun to come to the meetings because we had a friendship with each other and I really looked forward to it. And it was a lot easier for me to learn and to be candid about my experiences because of that trust. I've also learned how important it is to advocate for your needs and preferences. This has been, again, I think a big thing with having such good trust. I've been able to learn how to articulate what I am and am not comfortable with, and that's made this whole process really great for me. And then last, I've seen such value in skill and capacity building, not just with youth, but also with the researchers. It's been really cool to see Brooke also learning from us. And yeah, I think that's a huge thing of like, all of us bring such unique perspectives and experiences, and we can all learn so much from each other. And so Brooke being willing to learn has been a really awesome experience because we've all kind of just been in this together and learning and going through all these different processes together.
Beautiful. Thanks so much for those reflections, Megan. So we'll end with some key takeaways. I hope that we've demonstrated the value of really reflecting on one's epistemological commitments, guiding research paradigm and values prior to engaging patients and sort of selecting your methods for a project. And I hope we've illustrated that partnering with young adults can certainly enhance the relevance, practicality, and possible uptake of this research using sort of youth-centered methods for sharing the findings, including social media. This study demonstrates how multiple data sources, so not just qualitative and quantitative, but also patient partners' lived experiences, can be used to best address research questions. And as we know, this is a key tenet of pragmatism. Our adaptations throughout this research process to accommodate real-world challenges and the preferences of YARP members also illustrates pragmatism's alignment with patient-oriented research and action. And I'll just sort of hammer home that point about how involving the YARP throughout study phases, including data collection, recruitment, and data interpretation, has really grounded the study's findings in lived experience and is ensuring that we're considering the real-world applicability of the findings. And I'll just say lastly, the involvement with this YARP group has greatly expanded my perspective on research and youth health and mental health more broadly. And I'm so excited to see where all the YARP members go from here. So at this time, we will, I think, acknowledge all of our fantastic team members, my supervisors, and our funders. And I think we've got about 10 minutes for questions and discussion.